my dear friends. I welcome you all to the today's daily dose. I am myself Dr. Rajesh Gubba. I am a cardiologist and I am also the mentor for teaching general medicine in exams like NEET PG, AIMS, PGI and as well as JIPMA. So as a part of today's daily dose, the question is, all of the following are indicators for use of corticosteroids in SLE except. The options are neuropsychiatric lupus, pericarditis, endocarditis and nephritic syndrome. Now, if you take the mainstay of management for patients with SLE, the mainstay of management for patients with SLE is the steroids. But there are certain clinical scenarios of SLE where the steroids are not indicated. For example, if you take in this question, it is in case of endocarditis, the corticosteroids are not indicated. And what is the endocarditis manifestations of your SLE? That we call it as Liebman-Sachs endocarditis. Right, that we call it as Liebman-Sachs endocarditis. So in case of Liebman-Sachs endocarditis, what is the ideal management here? The ideal management that you need to give in this patient is valvuloplasty. So valvuloplasty is a line of management that you need to give in patients with the Liebman-Sachs endocarditis. But now let me tell you what are all the various clinical scenarios of your SLE where the steroids are not indicated. Like for example, you take the other options. The lupus cerebritis, steroids are indicated. Nephritic syndrome, the steroids are indicated, right? And what is the most common CNS manifestation of SLE? That is your cognition, right? In cognition, like we need to give steroids. So cognitive impairment is the most common CNS manifestations in patients with the SLE. And even in pericarditis also we give steroids because the steroids are anti-inflammatory drugs that can reduce the inflammation of your pericarditis, right? Now let me tell you what are all the various indications where the steroids are not indicated in patients with the SLE. Liebman-Sachs endocarditis, steroids are not indicated where you need to do valvuloplasty. Then if the patients with SLE develops your APLA syndrome, there also we don't give steroids, we give anticoagulation with heparin or warfarin, then the antiplatelet drug, that is aspirin. Next, skin manifestations like photosensitivity. Rather than steroids, your hydroxychloroquine will be more helpful. Whereas in lupus nephritis with end-stage renal disease, transplantation is very much required. But in patients with nephritic syndrome, steroids are indicated. But same patient with end-stage renal failure, transplantation is indicated, steroids are not useful. And whereas you take in patients with CNS psychosis, see, lupus cerebritis, steroids are indicated. But the same CNS manifestation, if it is in the form of psychosis, we should not give steroids. So for psychosis, for SLE, where the individual is developing CNS lupus, the haloperidol is the drug of choice, right? And if you take one more question on the SLE, all are true about the drug-induced lupus SLE except female to male ratio 9:1, anti-histone antibodies, CNS involvement not common, renal involvement not common. Now, if you take this drug-induced lupus, the first and foremost, the question that is asked is, what is the most common drug which is responsible for the development of drug-induced SLE? Now, the answer to this particular question here is, it is procainamide. Procainamide, it is an antiarrhythmic drug. So this is the drug of choice for drug-induced SLE. Now, whereas you take the antibodies in patients with the drug-induced SLE, it is your anti-histone antibodies. And in patients with drug-induced SLE, let me tell you, the CNS involvement is rare. Kidney involvement is rare. Episcleritis is also very rare. But skin manifestations, if you take, they are very common in patients with the SLE. And the age group at which you will get this particular drug-induced SLE is more commonly around the age group of 50 to 70 years. Whereas you take patients like of SLE, you will see more commonly in middle-aged females, like around 30 to 40 years. Right? Whereas drug-induced SLE, it is more common in patients of age group around 50 to 70 years. And let me tell you some more differences between the SLE and as well as drug induced SLE, right? So I said you the age group, it is around 20 to 30 years or 30 to 40 years, but whereas drug induced SLE it is around 50 to 70 years. And if you take female to male ratio in SLE, females are more prone than compared to that of males in case of SLE. That is almost ratio is 9:1. Whereas in case of drug induced SLE, the ratio is almost like 1:1. And if you take the antibodies in SLE, it is your anti-dsDNA, anti-Smith, and as well as ANA. Whereas in drug induced SLE, it is your anti-histone antibodies, which are the very important antibodies for drug induced SLE. And apart from this anti-histone antibodies, the other antibodies are the anti-single stranded DNA being present, whereas anti-dsDNA it is rare. Right? Anti-dsDNA is rare, whereas anti-single stranded DNA it is being present. Whereas you take the complement levels. Complement levels in case of SLE they are reduced, whereas complement levels in patients with the drug-induced SLE that is normal. Then coming to the skin findings or cutaneous findings. Cutaneous findings, they are seen in almost more than 75% of individuals in SLE, but it is seen only in 25% of individuals with the drug-induced SLE. And Raynaud's phenomenon, which is nothing but the peripheral vascular disease manifestation, that is more common in patients with SLE rather than drug-induced SLE. Whereas you take ANA, anti-nuclear antibodies, which is a best screening test. They are present in almost both the individuals, even in patients with SLE also. More than 95% you see that it to be positive, and even in patients with drug induced SLE also it is more than 95% to be positive. But what are the most specific antibodies for drug induced SLE? It is antihistone. For SLE it is your anti-Smith antibodies, right? So that is a very important, anti-Smith and as well as anti-dsDNA, both are the most specific antibodies for your SLE. So these are some of the questions related to this particular topic of SLE. So I hope you might have liked this particular short video. So please do follow us on the Daily Dose for the daily updates. Thank you very much.